I'm going to answer everything you wanted to know, but were too afraid to ask about Xeomin. Question 1, right off the top. What is Xeomin? Xeomin is a neuromodulator. The most common neuromodulator in the United States is Botox Cosmetic. Xeomin is right up there with them, and it is very, very popular because it works in a very similar fashion and it gives you a nearly identical clinical outcome. So people use Botox to reference the entire neuromodulator category. Well, Xeomin is part of that category. Question 2, how does Xeomin work? Well, Xeomin, like Botox Cosmetic, is a neuromodulator. So let's take a brief second to break down that word. Neuromodulator. Well, what does it do? It does neuromodulation. Really, in essence, what it does is it prevents the communication between nerves and muscles. And when those muscles can't receive the signals to move, well, they relax. And when they're relaxed, well, then fine lines and wrinkles can disappear. And Xeomin does this through neuromodulation, giving you a more relaxed, more youthful improvement in your overall cosmesis. Question 3, is Xeomin safe? This is a bit of a loaded question. In the interest of full transparency, it is believed that pound for pound, neuromodulators are one of the deadliest substances in the world. However, when used appropriately in the doses that are used within an aesthetic dermatological setting, Xeomin is exceedingly safe. Now, of course, there's some unwanted side effects. Number 1, it is a needle going in your face, so there's a tiny little bit of pain. Number 2, anytime a needle breaches the skin, well, you could have a bruise. And then number 3, although uncommon, you can get a ptosis or a droop because some of those muscles will relax, and when that happens, some of the skin may come down just a little bit, temporarily giving you that unwanted droop. But overall, Xeomin is exceedingly safe. Number 4, is there any downtime with Xeomin? There's definitely not any downtime with Xeomin per se. You could have a little bit of a bruise very temporarily. It'll go away in a couple days and you can always cover it with makeup. But overall, Xeomin really doesn't have any downtime associated with it, or at least none of the downtime that we associate with other cosmetic procedures like laser treatments. Question 5, when will I see results from Xeomin? Xeomin typically starts to work in about 24 to 48 hours. So within 1 to 2 days, you'll start to notice the beginning of a nice cosmetic result. The strongest it's going to be is day 10 to 14. So in about a week and a half to 2 weeks, that's when it's going to get very strong. 6 weeks is where it's going to look, to me, it's most natural. It'll start to look really relaxed. And then, in anticipation of your next question, it slowly wears off over the course of about 3 to 4 months, typically. Question 6, can you use too little or too much Xeomin? This is a fascinating question. The biological curve of the clinical outcome of Xeomin is dependent upon the dose. So again, another way to say this is duration equals dose. Meaning if you use too little Xeomin, nothing bad's gonna happen at all. It's just not gonna last as long. Instead of getting 3 to 4 months out of it, you may get 2 to 3 months out of it. Conversely, if you use more units of Xeomin, it will last longer. Sometimes you can get as much as 5 to 6 months out of Xeomin if you use more units. Typically, again, the result we're really looking for is somewhere within that 3-month range. Question 7, how many Xeomin treatments do I need? Well, that really depends on what you're trying to accomplish. Typically with neuromodulators, patients come in a few times a year, maybe 3, maximum 4 times a year, to keep a very relaxed, wrinkle-free expression. Question 8, how many units of Xeomin do I need? Well, the FDA has made recommendations as to how many units of Xeomin you need in certain areas of the face. This is also dependent upon what you're trying to achieve. It's dependent upon the amount of existing wrinkles you have. It can depend on your musculature, meaning that muscular men are going to need more than a smaller woman. And ultimately, it depends on the discussion that you have with your clinical practitioner. So my recommendation to figure out how many units you need is to have that discussion with a healthcare provider that you trust. Next question, is there any noticeable difference between using Xeomin or Botox Cosmetic? Well, the truth is that neuromodulators have much more in common than they have in difference. And what that means is that if you use the same number of units of Xeomin and the same number of units of Botox Cosmetic, for the most part, you'll get an identical clinical result. Where can I get Xeomin? Well, if you mean on your body, the number one place you can get Xeomin is the glabella complex. That's the frown lines that are located in between the brows, and they're often called the 11 lines or the 111 lines because they're vertical lines and they look like the number 11 or 111. The second most common place to get Xeomin is the frontalis muscle. That is the forehead, and movement of that muscle results in horizontal lines. So getting neuromodulators like Xeomin in the frontalis can minimize those unwanted lines on the forehead. And the third most common place is around the eyes, known as the crow's feet or the orbicularis oculi muscle, and that will prevent lines forming in that area. But there's off-label uses, the lip flip, the neck, other places on the body where you can use Xeomin. Can someone develop a tolerance to Xeomin? This is a really interesting question. Xeomin typically does not result in a non-responder or in a resistance or in a tolerance, and that's because Xeomin has a molecule, the neuromodulator, but it does not have an envelope around it, and as a result, at least me, theoretically, our industry, we think that you are very unlikely to develop resistance to neuromodulators like Xeomin. What age should I start Xeomin? That depends if you're trying to correct lines or prevent lines. If you're trying to correct lines, well, you're going to start Xeomin at whatever age you develop these static lines. Static lines are lines at rest. Dynamic lines or kinetic lines, those are lines with movement. Everyone has those, even babies have those. So kinetic lines, dynamic lines, well, those are where you're going to eventually develop the static lines. So if you can see a dynamic kinetic line you don't like, you can prevent it from becoming a static line by starting using Xeomin then. So to answer your question, start using Xeomin when you want to correct a line, or if you want to get out in front of that, start using Xeomin when you want to prevent the formation of a line that you anticipate receiving. Will Xeomin give me a frozen look? The answer to that is, if you want one. No, but very, very seriously, some people do want a frozen look. They want very, very, very little movement. Conversely, some other people want more of a relaxed expression. So what you're trying to achieve really comes down to your communication with your healthcare provider. If you want very little movement or very little movement in a specific area, all you have to do is express that so that they can use a few more units. If you want a more natural look, well, also communicate that information so that they can use less units. See, the biological curve of Xeomin, well, as the name suggests, it's a curve. So the strongest it's going to be, again, is day 10 to 14. Where it's going to look more natural is around 6-week mark. Needless to say, you have to communicate what you're trying to achieve so that your healthcare provider can pick the number of units and the correct muscles to inject those units in. There you have it, everything you wanted to know about Xeomin, but were afraid to ask. So, if you're no longer afraid to ask, come try it at any LaserAway location. We've used more Xeomin than any group in the entire world. Always wear your sunscreen. Dr. Kirby out.
Ready to be a laser babe? 3 steps. 1, subscribe to our channel. 2, watch more amazing videos. And 3, schedule your free virtual consultation for any of our services by clicking the link below. Then we can be friends in real life. Bye.